Hello everybody, this is Dr. Kukreja Kalani and today I'll be talking about the congenital heart defects which are found in newborn baby. So let's talk about what are the symptoms for this problem or the disease where we have a newborn or a child where he's diagnosed with some defect in the heart. So what are the symptoms? So basically we'll find that there's a labored breathing, so difficulty in breathing which is very visible. Secondly, that is the bluish tinge to the lips, and the nails are also discolored. There is blue color of the nails because of the cyanosis, because the less amount of oxygen is reaching to the peripheral parts of the body. Later we have intolerance to exercise and constant fatigue, poor feeding and poor weight gain. Plus, upon say if the parents take the child to the doctor on auscultation of the chest, there is additional sounds that are present, which are called as the murmur of the heart. So this can raise a suspicion as to there could be some problem, and on investigations we find out there could be defect in the atrium, between the two atrium or the ventricle. So what are the common defects which are found in newborn babies? That is at the time of birth itself, because of the genetic inheritance or some sort of chromosomal defect or problem, or because of the environmental causes, there is some structural defects which are found in small babies. So we have ASD, that is the atrial septal defect. That is, these are the beating chambers of the heart. So the communication between the two atrium which is not normal, there could be a hole between the two. Then we have the ventricular septal defect. So if there's a hole between them, then the oxygenated and the deoxygenated blood keep mixing, which should not happen. Then we have the left side of the heart that is not developed well, which is called as the hypoplastic heart syndrome, which is found in babies. Then we also need to make people aware about a condition where the main vessel which carries the oxygen to various different part of the body, that is the aorta, there could be narrowing in some section of the aorta, because of which there is an oxygenation error. So these are the common defects which we can which are found in small children. It's very important that the problem should be identified early as possible, and so that intervention can be done. It could be managed with medicines, or sometimes multiple surgeries need to be done so that the defect can be. Now 1 out of 100 children is known to have this type of defect. So it is very important that it is diagnosed early, because if the defects are multiple, then the mortality rate is high. So this is all about the awareness, so that the parents should be aware about such condition, and early diagnosis is important because the prognosis and results are better.